Right now, 846 people in North Carolina are in the hospital fighting COVID-19. That's 17 more people since yesterday, and now the highest daily count since the pandemic started back in March. 86% of all hospitals reported their data today. Hospital systems still have enough beds to take care of people. 23% of the intensive care unit beds in the state are still available. And there is still a large supply of ventilators. Only 27% are currently being used. In total, nearly 47,000 people have contracted this virus in North Carolina. The state estimates more than 29,000 people are no longer sick. 1,170 people have died.
8 Greensboro firefighters are fighting COVID-19 right now. 13 tests came back negative. Now, the fire department is still waiting on 20 more additional tests. Earlier this month, 6 firefighters began experiencing coronavirus symptoms. Some experienced their symptoms while off the clock, while others say that they had those symptoms when they returned to work. All infected employees are now at home. They say all trucks and stations are staffed. A Winston-Salem Transit Authority employee has tested positive for the coronavirus. The employee confirmed that they did not contract the illness while working. Any employees who may have come in contact with this infected employee is required to wear face mask covering. Meantime, the Transit Authority is also providing free masks for passengers upon request. The buses are still up and running.
Well, even with safety measures in place, downtown Winston-Salem restaurant owners say their customers are taking phase 2 at their own pace. WXIT's Leanne Danier joins us now with a check-in on dining in. Leanne?
Yeah, we stopped by several Winston-Salem restaurants today as customers were dining in, having their lunch. But the owners that we talked to said it took a lot of work to get those folks inside, and they're hopeful, though, that they will continue to come. From the plexiglass barriers to a hands-free washing station to changing the way staff and customers move through the restaurant, Camel City Barbecue Factory is serving its guests in new ways.
It's been very stressful, but also there's been great joy in getting the restaurant back open.
Restaurants are back open for dine-in customers in phase 2 of North Carolina's reopening plan. Still, owners told us people are taking it at their own pace.
Traffic is exponentially increasing downtown as far as foot traffic, and it's great to see Winston-Salem coming back around and people moving, going back out to eat.
King's Crab Shack and Oyster Bar owner Will Kingery says for him, getting to this point felt in a way like starting from scratch.
So with 3 restaurants, it's like reopening 3 restaurants at one time.
But even with diners coming back out, both owners say there's still a worry.
It's so good to hear the sound of people eating, enjoying food, and having laughter. Have not heard that in these halls in 3 months.
Do you think you guys are going to be okay?
It's hard to say. It's hard to say. We don't know what the future holds. I'd say we're very blessed, but that doesn't mean that it can change on a dime.
And both the owners that we spoke with today say that the safety measures are just as much for their customers as it is for their staff. They want everybody to stay safe and stay healthy. Both the owners thanking their staffs for being so positive and for working with them as they all try to move forward. In Winston-Salem, Leanne Danier, WXII 12 News.
Great perspective there. Thank you, Leanne. A Wake Forest University student says being on the front lines of COVID-19 has changed his life. Senior Davis Fedman spent 5 weeks, in New York helping COVID-19 patients. He is a certified EMT and worked 12-hour days inside of a tent hospital located on top of a soccer field at Columbia University. He worked with a unit with 36 patients. He says his time there has certainly prepared him for his future career.
My hope is to be an emergency physician one day. And I think these experiences and the experience of being in New York and talking with patients who have been isolated for 30 or more days is eye-opening.
Feldman says that he wishes his stay in New York was longer and he would go back again if needed.
The pandemic has kept a lot of people isolated from family and friends, especially our most vulnerable populations, like people living in nursing homes and assisted living centers. Our Bill O'Neill explains what North Carolina's top health officials are doing to help them stay safe and stay connected.
Dr. Cohen, who heads Health and Human Services, answered questions for roughly an hour today, most of them dealing with testing and masks. but one of them dealt with depression and the impact the pandemic is having on people in nursing homes.
Representative Perrin Jones, a medical doctor representing Pitt County, told the committee hearing today about a couple in their 80s, married more than 50 years, living in separate wings of the same nursing home, unable to be together because of the virus.
When they were finally allowed to see one another last week, they were forbidden to touch and had to view one another through a glass divider. The husband sobbed for 30 minutes before saying a word to his wife.
It's unbelievably heartbreaking.
Dr. Cohen agreed with Representative Jones about the toll isolation is having on nursing home residents, but blames the problem on federal regulations.
What do you propose now to do to rectify the inhumane consequences of our state's public health policies as it relates to this group and help bring these couples and their families back together?
Dr. Cohen says the state is looking at proactive testing as one way to ease restrictions at nursing homes.
At the beginning, when we didn't know a lot about this virus and we had to just throw everything we possibly could at this to protect lives, we threw some very crude measures there. I'd like to see us get to a place where we can be more nuanced. The issue is this virus is just incredibly vicious and deadly for folks in our nursing facilities.
I appreciate the answer. These are people that are truly dying from depression right now. This is an issue that needs to be addressed now.
Lawmakers have come up with their own plan to help fight the isolation in both nursing homes and hospitals. It is a visitation bill called No Patient Left Behind. However, Dr. Cohen notes that bill is in conflict with federal rules and regulations. In Greensboro, I'm Bill O'Neill, WXII 12 News.
Breaking news just into the WXI 12 newsroom. We are learning more than 100 people in Guilford County have died from COVID-19. More than half lived in nursing homes and residential long-term care facilities. 2 new deaths were reported by the county less than an hour ago. Guilford County is only one of 2 counties in the state to report more than 100 deaths.
Dr. Mandy Cohen says recent scientific studies prove that masks and face coverings are effective at limiting virus transmission. She told members of the House Health Committee that communities where everyone wears a mask could get their economies back open quicker and safer. Her comments come 2 days after the governor said the state is weighing whether to mandate masks in public.